We can see here, the first you have to write your name, whatever your name, like Hemant Sharma. Mobile number. The formula of Chong. What is the formula of Chong? Master point, spleen 4 and the pericardium 6 is the couple point. No doubt this is the formula. तो इसका पहला आंसर सही है. The question number 2, Chongmo roots goes from, acrosses from, cross from. तो पहला आंसर गलत है. ये तो स्प्लीन मेरिडियन है. This is not the Chongmo. So the right answer, when the Chongmo meridian is passing, it also passes from kidney 1, kidney 11 to kidney 21. ये किडनी 11 से किडनी 21 का जो रूट है वहां से भी चोंगमो निकलता है, राइट. तो हमने समझे थे चोंगमो इज हैविंग मेनी रूट्स एंड वन रूट इज which is passing from most of the kidney points. That's why whenever we want to treat the kidney, we always think about the Chongmo. हम जब भी किडनी को ट्रीट करना चाहते हैं हम चोंगमो का जरूर प्लान करते हैं, राइट. So it's clear now. Everyone is having clarity for this. No one is confused about the root of the Chongmo. Yes. So we can see here. This is the root of the Chongmo. We can see the first branch going in the genital part, the second branch, stomach 30, flow through the stomach 30. The third branch going upward in the chest and the throat, lips and all. The fourth branch going in the legs. Fifth branch is going on the feet. तो ऐसा कुछ नहीं है. स्टमक 36 वाला तो कोई रास्ता ही नहीं है इसका. स्टमक 36 वाला तो कोई रूट ही नहीं है, राइट. वैसे भी चोंगमो के रास्ते में स्टमक 36 आता ही नहीं. स्टमक 37 भले ही आ जाए. Lower soup point of the Chongmo will be stomach 37, stomach 38, both are right, so both will be the answer. Lower soup point of the Chongmo. Upper soup point of the Chongmo, UB11 is the upper soup point of Chongmo. Chongmo ka jo upper soup point is UB11, that's why UB11 is the influential point of bone. That's why Chongmo is very good for bone, very good for spine, very good for vertebra. The Chongmo formula for male is spleen 4, pericardium 6 and stomach 30. For female, it will be the CV1. हमने समझा था. Spleen 4 left, pericardium 6 right, and stomach 30 bilateral for male, and CV1 violet, CV1 for female. So the answer is for male, stomach 30. For female, it will be 1, spleen 4, pericardium 6, and CV1 bilateral. 7. Chongmo works on dysmenorrhea, यानी जो दर्द के साथ पीरियड आता है उस पर, हार्ट पेन, हार्ट के दर्द में, improving the digestion. So answer is all. Chongmo is crossing these all things and working on all. Starting from point of Daimai. Daimai का जो starting point कौन सा है? तो हमने ये समझा था, we can see here this is a diamide. So the starting point of the diamide might be gallbladder 26 and or the liver 30. ये दोनों हो सकते हैं. So we can see here this is the liver 30 and the gallbladder 26. Both are the starting point of diamide. ये दोनों starting point of diamide consider किए गए हैं. So the starting point of diamide both are possible. Gallbladder 26 and liver 30. Diamide works on liver yang, control rising liver yang, burning urination, cold feet, all with the answer. Diamide controlling our belt meridian, हमारे बेल्ट वाले एरिया को कंट्रोल करता है. So it's controlling the liver yang, it's controlling the burning urine, it's controlling the feet, cold feet. It's improving the circulation in the feet. Question number 10. Diamide is good point for. Diamide वैसे तो सब चीजों के लिए अच्छा है, but it has a famous point for unmarried female. Unmarried female. It is a friend of unmarried female. तो जिसके सभी आंसर सही हैं उसके 50 आउट ऑफ 50 होंगे, और जिसके सभी आंसर सही नहीं हैं उसके कम होंगे. तो चलिए मैं देखता हूं किसके कितने आंसर सही हैं. किसने मेहनत की है, किसने मेहनत नहीं की, क्योंकि इतने सिंपल क्वेश्चन पूछे हैं हमने कि आपको बस थोड़ा सा अगर आपने ध्यान से पढ़ा हो तो काफी है. वन. तो देखिए अभी तक 54 लोगों ने दिया है. 54 लोगों ने, राइट, जिसमें से 20 लोगों के 50 आउट ऑफ 50 हैं. 50 आउट ऑफ 50. लेकिन जिन लोगों के 30 हैं उन्हें सच में मेहनत करने की जरूरत है. 30 तो बहुत कम नंबर है भाई, एज पर दिस वेरी सिंपल पेपर. कई लोगों ने चोंगमो के रूट में फॉर्मूला ऑफ चोंगमो देखते. कुछ लोगों ने लोअर सू पॉइंट ऑफ द चोंगमो किडनी 9 लिखा है, जो बिल्कुल गलत है, सरासर गलत है. लोअर सू पॉइंट ऑफ द चोंगमो किडनी 9 तो कभी नहीं बताया, किसी ने भी नहीं बताया. इर्दा UB20, it is stomach 37 and 38. Upper Su point UB11, but many person has written UB13, UB15, UB stomach 36. छोड़ा नहीं है कुछ भी, सब लिख दिया है. डायमंड वर्क्स ऑन, बहुत लोगों ने लिखा है लिवर राइजिंग लिवर या, लेकिन भूल गए वो कि डायमाई भाई पैरों में भी ऊर्जा भेजता है और हमारे बर्निंग यूरिनेशन को भी कंट्रोल करता है। तो थोड़ी सी मेहनत की जरूरत है, यानी जितने भी ऑप्शन दिए हैं किसी ना किसी ने हर ऑप्शन लगाया है। अगर मैंने 10 क्वेश्चन दिए हैं और हर क्वेश्चन के चार चार ऑप्शंस दिए हैं, तो ऐसा नहीं है कि एक भी ऑप्शन किसी ने छोड़ा। हर एक ऑप्शन को एक ना एक ने तो टिक मारा ही है ना। अभी मैं नाम नहीं लेना चाहता, अगली बार तो मैं नाम लेके बुलाऊंगा भाई। इतना सिंपल पेपर और इतनी सारी गलतियां। कोई बात नहीं, अभी ईओबी क्विज जब 2 होगी तब उन लोगों को प्रिपेयर करना है जो पीछे छूट गए, और जिन लोगों के 40 से ऊपर मार्क्स हैं विल अप्रिशिएट देयर एफर्ट्स। एक आध मार्क्स तो कभी कंफ्यूजन में गलत हो जाता है, एक आध क्वेश्चन वी कैन अंडरस्टैंड, बट एटलीस्ट इफ एनीवन हैज 40 प्लस मार्क्स, 45 और द 50, वी विल अप्रिशिएट देयर एफर्ट। उसके नीचे हैं, वी विल नॉट अप्रिशिएट देयर एफर्ट। तो उनको मेहनत की जरूरत है, उनकी मेहनत कम है, ठीक है। और उनसे हम उम्मीद करेंगे कि अगली क्विज में जब भी हम लेंगे वो बाकी लोगों को भी 40 आए हैं इट्स गुड, लेकिन किसी को 35 आए हैं, 30 आए हैं, 25 आए हैं, वो कम है। अगली बेसल्स हमारी होगी नेक्स्ट। अभी मैंने डाइमई चोंगो का क्विज किया था ना। नेक्स्ट बेसल, विच बेसल यू वांट, टेल मी योर चॉइस। सो नेक्स्ट बेसल, ओके फाइन, यिन एंड यांग लिंकिंग बेसल। लिंकिंग बेसल अगली हमारी होगी क्विज ऑन फ्राइडे। फ्राइडे मीन्स यू हैव वन डे, you have to tomorrow and day after tomorrow, 2 days you have. So the next quiz will be yin linking vessel and the yang linking vessel. So let's start the discussion of our current topic, which is CB meridian. Yes, Kamakshi ji, any question?
Yes, sir.
हाँ बोलिए।
Sir, now we are using the Chongmo number that Chongmo vessels with that points. Can we add Mastertuk points?
Yeah, definitely we can add. We can make the
Is for diabetics. I first put these 2 points SP4 and PC6, and along with that master thing lower 3 emperor, and like that can I add?
Yes, definitely you can do that.
And in any vessels we are doing it with, we can add with the TCM plus master tongue like that.
Yes.
Can I?
Yeah, we can do
Okay.
that. Yes. Okay, fine.
Thank
Bye.
you.
So yesterday we have started the discussion of Renmai. हमने रेनमाई का डिस्कशन प्रारंभ किया था। Renmai, we told the many other names like, but the main name is CV channel. CV channel इसका एक नाम है, मालूम है? So conception vessel, we already know starting from CV1 till the CV24. We have discussed a lot that this is called is the yin vessel. ये yin vessel है. This improve the yin. ये yin improve करती है. And we have divided in 3 parts. हमने 3 पार्ट में बांटा था. The first branch is REN 3 there are 4 branches of REN meridian. So the first branch from the REN 3 going downward in the genital part. एक branch REN 3 से नीचे जाती है. So that's why when you are treating the CV meridian, you are working on the genital part. The master point of the CV meridian will be lung 7 and the couple point is kidney 6. Lung 7 is the master point and the couple point will be kidney 6. So when you are treating the lung 7, the kidney 6, you are working on the genital parts. So it's a very important combination for the person suffering with uterine problem or the hysterectomy, uterus निकाल दिया है, uterus की कोई problem है, or the prostate problem or any type of the genital problems. It's very good. This is the first branch. So the lung 7 point is located here. Lung 7 point कहाँ होता है? Lung, we can see here, this is the depression. From this depression, if I keep my 2 fingers on the bone, there is a location of the lung 7. हमें lung 7 की location मिल जाती है. So lung 7 is a very good point for genital part. Let's see in this image. So we can see here the lung 7 point. This is the lung 7, which is 1.5 chun away from the wrist. हमारी wrist से 1.5 chun दूर होता है. This is the depression here that is called anatomical snuff box. यहाँ पर एक depression होता है. It's look like triangle. This is called anatomical snuff box. From here, if we go 1.5 chun, we are reaching on the bony part. There is the location of lung 7. So now we can see here in the master tongue acupuncture, they told if from the wrist we put 1.2 chun up, 2 chun up, and the 2 chun up, 2 chun proximal, 2 chun proximal, 2 chun proximal. In the master tongue, it has been told if we are putting the 3 point in the line, which is first point 2 chun proximal, second point 2 chun proximal, third point 2 chun proximal. These 3 points are very good for any problem of the genital part, uterus, any problem in the lower part. किसी को भी lower part की कोई भी problem हो, piles, fistula, hemorrhoid, uterine polyps, prostate problems, any problem in this part, we can treat with the help of these 3 points combination. And lung 7 is located here. Okay. तो थोड़ा सा मास्टर टंग के 3 पॉइंट बड़े गजब के हैं. अभी हमारे एक पेशेंट है, उसको मैंने कुछ महीने पहले ये 3 पॉइंट्स लगाए थे और बताया था ये 3 पॉइंट गजब के हैं. अब वो क्या करता है कि खुद सुजोग निडल लगा लेता है उन्हीं पॉइंट्स पे पेशेंट, और कहता है बड़े गजब के पॉइंट है. Whenever I suffer with the piles pain, I put these 3 points. और उसके निडल लगा लगा के वहां 3 ऐसे निडल के निशान बन गए, खुद लगा लेता है भैया 3 points. So these 3 point combination is very good for white discharge, leukorrhea, any problem which is connected with the female reproductive parts, male genital part, prostate enlargement, and all. And as per that EOB, we can use lung 7 as a master point and kidney 6 as a couple point, and we can see the great effect. So this is the first branch, starting from REN3 and moving downward. Here, REN3, one of the great points. REN3 is the point where all the 3 meridian of the legs are meeting. From the legs, liver meridian is coming, kidney meridian is coming, and the spleen meridian is coming. From this side as well as from this side. So REN3 and even the REN4 are the meeting point of all the 3 yin meridian coming from the leg. And these 3 meridian also influencing the uterus, prostate and all. तो REN3 भी एक गजब का पॉइंट है। REN3 पर हमारे तीनों yin meridian मिलते हैं। Even on the REN4, that's why REN4 is also very good point. REN4 को तो बुढ़ापे को भगाने वाला पॉइंट कहते हैं। REN4 is very good point for old age person. In the old age, if someone is suffering with the liver problems, with the kidney problems, with the spleen problems, any type of the aging problems, urinary problem, stool problem, CV4 is very good point, and there is a single point for old age. Then the second branch, going in the midline and reaching till the CV24. हमारी दूसरी branch, the second branch crossing the stomach, so liver, gallbladder, stomach, spleen, crossing the chest, so heart and the lungs, and even the ribs, and the throat. So any problem with the abdomen, any problem with the chest, any problem with the throat, like the throat infections and all, any problem of the lower jaw, then reaching to the CV24. So this is the second branch. ये हमारी second branch है. This is very much important branch because there are many points coming in the route like CV2, CV3, CV4, CV5. Each point having their significant importance. हर पॉइंट का अपना एक महत्व है। कोई पॉइंट स्टमक के लिए अच्छा, कोई पॉइंट हार्ट के लिए अच्छा. These points are very good for different organs. Some points good for heart. We will discuss them shortly. Then the third branch is circling the mouth. So there are very good benefits. The third branch is making circle around the mouth. So there is a connection of the REN meridian with the DU meridian. Because we know on the face, above the lip DU, below the lip REN. So the third branch is circle around the mouth, connect with the DU. So it's a very good, CV meridian is very good if the person is suffering with any type of the mouth problem. Then it's circling the DU meridian and ends on the eyes. So that's why CV meridian is very good for mouth, very good for face, throat and eyes. Even we can choose ear teething for the eyes. And the fourth branch is going in front of the spine. ये हमारे DU channel के आगे आगे चलती है. Third branch, fourth branch. So that's why with the help of CV meridian, with the help of lung 7, the kidney 6, we can treat the genital part, we can treat the hemorrhoid, we can treat the menstrual problem, we can treat all the genital problems. We can treat the abdominal problem, chest problem, throat problem. We can treat the face problem, mouth problem, eyes problem, and we can treat the problem with the spine. Right? It's a wonderful combination. Then we have divided this many parts. So let's see the CV1. CV1 is also called ghost point. In the previous classes, we have discussed about the ghost point. If you want to go through with the ghost point, again, you see one YouTube video, you can write ghost point in acupuncture and my name, so you will find one full video. Ghost point, CV1 is the ghost point. So the CV1 is the very effective points and called meeting point of the yin. That's why when we are stimulating the CV1, it's improve yin. ये yin को improve करता है. हम सिद्धासन का अभ्यास भी कर सकते हैं. सिद्धासन आप जानते होंगे. सिद्धासन में क्या होता है कि एड़ी को इस बिंदु पर लगाकर हम बैठते हैं. The name itself is Siddhasan. It's a very important asana to ignite the Kundalini Shakti. We can see in this image. So when the person doing Siddhasana, it's putting the heel, one heel under the CV1. And you can practice for 5 minutes or at least 2 minutes every day. It will improve the yin. ये yin को तो improve करेगा ही. It will improve your sleep. अगर किसी को नींद नहीं आती, CV1 will improve the sleep. So CV1 will calm down your brain. It's a very effective point. So the CV1 is the very much effective points. On the CV1, yin are meeting, we can improve the yin. And if we activate the CV1, it's also stimulating Chong and Do Mai. ये पीछे DU से भी जुड़ा है, आगे Chong Mai से भी जुड़ा है. So CV1 is very effective points. CV1 is improving the condition of the spine, as well as CV1 is improving the Chong. So it's the meeting point of the Chong and DU channel. And it improve ब्रह्मचर्य, it improve जिंद, it improve वीर्य. जिन लोगों के अंदर वीर्य की कमी है, जिन लोगों के अंदर जिंक की कमी है, we can improve the zinc because this point is improving kidney and marrow. Right? So it's a very effective point. We can praise this point. We can squeeze this point. हम इस पॉइंट को स्क्वीज कर सकते हैं जैसे अश्विनी मुद्रा के माध्यम से. We can practice the Ashwini Mudra. In the Ashwini Mudra, we are squeezing the anus. हम अपने anus को squeeze करते हैं. Squeeze करते हैं, छोड़ते हैं. We are squeezing the anus and releasing it. Do 100 times. And then you can repeat 2 to 3 times a day. अगर किसी के शरीर में yin की deficiency है, तो आप उसे जरूर एडवाइस कर सकते हैं कि भाई अश्विनी मुद्रा का अभ्यास करो. Many persons suffering with the yin deficiency. Not only this, if you're thinking the person is having chances to suffer with the prostate enlargement, which is because of the damp heat, or any type of the stagnation, जैसे यूट्रस में हो गया stagnation, painful uterus, painful periods, any problem happening in this part, CV1 one of the great point, right? So this is the CV1, and even If the person is suffering with any type of the problem here, we can take lung 7 as a master point, kidney 6 as a couple point, and we can add CB1. तो हमारा एक बहुत ही शानदार प्रोटोकॉल का निर्माण हो जाता है, right? So the CB1 is not only useful for yin, but any problem happening in the lower part, any problem happening in the lower GIO, whether the problem of urine or the problem of a stool or the genital problem, we can work on this point. Let's go to the CB2. हमारे पीविक बोन के ऊपर जो CB2 होता है, so CB2 is the point on the pubic bone, right? तो ये सारे पॉइंट्स लोकल प्रॉब्लम को ठीक करने के लिए मदद करते हैं. लोकल प्रॉब्लम मीन्स एनी प्रॉब्लम इन द लोअर GIO. We can work with the CB2. अरे CB1 के बारे में मैं एक चीज और बता दूं बिफोर CB1. अभी हमने जो CB1 की बात की थी, CB1 को प्रेस करने से टाइमिंग इंक्रीज होती है. टाइमिंग मतलब जल्दी डिस्चार्ज नहीं होता सेक्सुअल इंटरकोर्स के समय फॉर द मेल. CB1 will improve the retention of semen. Or CB1 is also the very good emergency point when someone become unconscious. एक्यूपंक्चर में कहते हैं कोई डूब के मर रहा हो और CB1 को दबाने से उसे होश आ जाता है. CB1 is very effective point for this purpose. So we can suggest the person that use this point. For the erectile dysfunction, this point is called $1 million point. तो CB1 को हम इरेक्टाइल डिस्फंक्शन के लिए $1 million पॉइंट कहते हैं. Point for erectile dysfunction or the early discharge, right? Fine. So we can stimulate this point in the correspondence में सुजोग में भी हम इस पॉइंट का स्टिमुलेशन कर सकते हैं. Now we are moving to the CB2. CB2 is useful for the local problems. Local problem again for the erectile dysfunction, for the impotency, for any problem in the lower parts. इस लोअर पार्ट में होने वाली कोई भी प्रॉब्लम के लिए CB2 भी काम करता है. 1 minute. Am I audible? Audible? Okay. So CB1 and CB2, both points are useful for the erectile dysfunctions. So CB1 and the CB2 both are working for the lower GIO, treating the urinary problems. CB3. Just I told you the CB3 is the meeting point of all the 3 yin meridian. So it's the meeting point of liver, kidney, and the spleen meridian. So it is treating all the problems which is connected with the genital part, because the branch to the genital part going from here. Anyone is suffering with the genital problem, we can take LU7, kidney 6, and CB3 without any problems. Then CB4 is the point. Again, the CB4 is the meeting point of all the 3 yin meridian, liver, kidney, and the spleen meridian coming from the leg. And the CB4 also the meeting point of all the three yin meridian. But CV4 is one of the great points. Why? On the one side, it's a meeting with all the three yin meridian. On the other side is also having connection with the Ming Meng chakra. ये हमारी Ming Meng chakra से भी connected है. That's why it can improve the yang and even it can improve the yin. ये yin को भी improve कर सकता है, yang को भी improve कर सकता है. It can improve the jing, birya. It can improve the chi. It can improve the blood. It can improve the essence. It can improve anything. CB4. It can improve the blood because the CB4 having connection all around. कि पैरों के तीन yin से भी जुड़ा है. Right? It's also having connection with the Ming Meng chakra. ये Ming Meng chakra से भी जुड़ा है. So CV4 is the very good point. It is also called gate of original chi. We can work for any problem happening in the lower part. CB4. If the person is more than 50 or the 60 years of age, nowadays 50 also, should stimulate the CB4 or can do the moxibustion here time to time. यहाँ पर moxibustion करना चाहिए ताकि उनके अंदर बुढ़ापे में होने वाली प्रॉब्लम्स के लक्षण ना आए. Let's move to the CV5. CV5 is the point which is the front view point of the triple boron meridian, and the triple boron meridian is the meridian who control water metabolism, because the triple boron meridian is having connection with the hypothalamus of the brain. So it controls the water metabolism, right? So regulate the fluids, regulate the urination. It treats the edema swelling and any unwanted stagnation in the lower part, CV5. Remember that CV5 means triple warmer, which is controlling the water metabolism. Then CV6, one of the great point. CV6 तो वो बिंदु है जो हमारे खुद मिंग मिंग चक्रा का बिंदु है. CV6. That's why the CV6 has been considered the reservoir of chi, and it can improve the chi. It can improve the kidney. It can improve the jing. CB6 also called vitamin point. CB6 को हम vitamin point भी कहते हैं. आप CB6 को ट्रीट करो, it improve the chi, it improve the yang, it improve the kidney chi, it improve the original chi, it remove the fatigue. It's very good for abdominal pain and the genital issue as well as asthma because it's working on the kidney. So CV6 is very good point. CV6 is called the ocean of chi. इसे हम ची का ओशियन कहते हैं. तो CV6 पर हम CV4 और CV6 पर लाल रंग भी लगा सकते हैं. We can put the red color on CV4. हम CV4 पर और CV6 पर लाल रंग लगा सकते हैं. To improve the energy, to improve the chi, we can put in the sujog and as well as on the local points, or we can do the moxibustion. हम moxa कर सकते हैं. And we already know CV6, stomach 36, and the CV12. These 3-point combination are very good for improving the chi. So CV6 is the C of chi. Now we are jumping on the CV8 on the navel region. On the navel, we never put needle. हम needle कभी नहीं लगाते, but we can do moxa. Navel is the place of original chi, which is called yuan chi. नाभि ऊर्जा का असीमित क्षेत्र है जहां पर हमारी ओरिजिनल chi पाई जाती है. Because in the childhood, when we are baby, when we are in the mother womb, we are connected with the mother through the navel. Even after the birth, we are having lots of original energy here. यहाँ पर बहुत ओरिजिनल ऊर्जा पाई जाती है, right? So there's a very good point who treating most of the problem. Like someone is suffering with a diarrhea or any problem of the intestine problem, gastric problem, we can do the moxibustion here. The CV9. The CV9 is called water separation point. इसे हम कहते हैं water separation, which is 1 inch above from the navel. It is called separation point. Okay, water separation. Separating pure from impure. अशुद्ध में से शुद्ध को निकालना. That is called water separation. It's not only on the physical level, but on the psychological level also. Right? So someone is having swelling, edema, water retention. CV9 is our very famous point. It will transform the fluid. हम जानते हैं कि किसी को भी वाटर, किसी को स्वेलिंग हो, इडिमा हो, हम CV9 की मदद से उस पर वर्क करते हैं. Right? So CV9 most of the time we are using for swelling, edema, for removing the flame and the water retention. हमारे शरीर में जो फालतू का फ्लेम या फिर स्वेलिंग हो जाती है, उसे हटाने के लिए हम इसका प्रयोग करते हैं. Now regarding the CB10, अब पहले मैं CB10 बताने के पहले आपको बता दूं थोड़ा सा about the CB10. मैं थोड़ा CB10 के बारे में आपको कुछ बताऊं. CB10 is one of the great point. If we see our stomach, अगर हम स्टमक को देखें, so this is the stomach. ये हमारा पेट है. We can divide the stomach in 3 parts. हम स्टमक को 3 पार्ट्स में डिवाइड कर सकते हैं. This is the fundus of the stomach, or we can tell upper part. This is the middle part, or we can tell the body of stomach. थोड़ा अलग तरह से बनाते हैं, चलिए. So this is the fundus. This is the body, and this is the last part that is called pylorus. So fundus के पहले यहाँ पर हमारा food pipe होगा, esophagus. Esophagus is meeting with the fundus of stomach, body, then the pylorus. After the pylorus is the duodenum. तो ये हमारा duodenum है. So the point of the fundus is CV10. यहाँ का point है CV13. CV13. The point of the body is CV12. And the point of the lower part is CV10. So CV13 is the point of upper gate of the stomach. CV12 is the point of the middle part of the stomach. CV10 is the point of the lower gate of the stomach. Right? In this way, we are having 3 very important points for stomach. So suppose we want to digest the food. Stimulate CV12. हम CV12 को स्टिमुलेट करते हैं. It will help in the digestion. ये पाचन में मदद करेगा. It will work on the digestive problems. Sometimes there is a stomach deficiency. कभी कभी पेट कमजोर होता है, स्टमक डेफिशिएंसी, देयर इज ए लैक सीक्रेशन ऑफ द juices and the acid. So CB12 will help in this. आयुर्वेद में कहते हैं सर्वे रोगा अपि मंदाग्नौ, सारे रोग अग्नि के मंद होने से होते हैं। तो CB12 अग्नि को प्रदीप्त करेगा और खाने को पचाएगा। So CB12 is very good point for this purpose. Sometimes what is happening after eating the food, even after many hours, we feel the food is still in the stomach and it is not going in the next part. खाना खाने के बाद भी अगर आपको लगे यार पेट अभी भी भरा है, आगे खाना जा ही नहीं रहा है, then we'll activate the CB10. CB10 will send the food in the next part, that is the duodenum. So CB10 is the very good point. When you want to send the food from pylorus to duodenum, जब खाने को आप पाइलोरस से डिओडिनम में भेजना चाहते हैं तो CB10 एक अच्छा काम करता है. CB10 वर्क नाइसली. So we can feel lightness in the stomach after some time. Now CB13 is the point on the upper part. Sometimes we are feeling belching, nausea, vomiting, food is going upward, डकारें आती हैं, हिचकियां आती हैं. So we will work on the CB13. So CB13 is the point who is working on stagnation. Stagnation means or contraction. जब खाना रिवर्स मारता है तो हम CB13 के माध्यम से हम कॉन्ट्रावक्शन को ठीक कर सकते हैं. So CB13 is the point of the upper part, right? So these are three very, very important points and we can choose the points as per the need. हम जरूरत के आधार पर इन बिंदुओं का चयन कर सकते हैं, right? So CB10 is the point of the lower part of the stomach. Now from this point onwards we will discuss in the next class. और आगे का डिस्कशन हम अगली क्लास में करेंगे. So thank you so much. Let's close the session.